Okay, we're good? All right. Call to order. We have roll call.
Dr. Moore,
Yes.
Dr. Robinette. Here. Dr. DeGuzman, Mr. Witt. Here. Dr. Gullidge, Mr. Adamson,
Here.
Mr. Griffith.
Here.
Okay, we have, are there any additions to the adoption of the agenda? Okay, roll call. Voice.
Motion.
So moved to accept.
Second.
Okay, all in favor, say aye.
Aye.
All opposed, same sign. Okay. Looking for approval of the last minute meetings. There's no request for changes, then I'd like to have a motion.
So moved.
Second?
Okay, we'd like to have a voice vote. All in favor, say aye.
Aye.
All opposed, same sign. Okay. Public comments. Okay.
The folks that are here are on the agenda, so I think
Okay,
you're good.
we'll just keep on moving. All right. Old business, we have the Springfield landfill. Mr. Wood.
Thank you, Dr. Moore. So during the December meeting, you guys placed a condition on the license approval for the Springfield landfill that they needed to submit all components for facility operation as required in the Ohio Administrative Code by June 1st, which at that time you then consider possible suspension or revocation actions if necessary. And since that falls between our two board meetings, we're providing you with an update this evening so you can decide how you want to proceed. I think the consultant for the landfill is here, and I'll let him give you guys the update on what they've done and the timeline for accomplishing the other tasks. Mike?
I've done this before, so I know what to do.
Okay.
Good evening. My name is Mike Stepik. I work for a small consulting firm out of Akron called River City Engineering. Is that 6 minutes I have, or is that 6:02?
It's time.
Game show, and I hear Jeopardy music. We were put under contract, we were reached out to by Tony Smith for Springfield earlier this year, as soon as he got the letter shortly thereafter, and have been myself at Rubber City and my team, as well as another consulting firm out of Worthington, Ohio, Egan Associates, who specializes in this kind of groundwater work, and that has been working towards getting everything squared away. Part of that was a file review at the health department. Obviously, over 25 years, there's a lot of different paperwork and getting up to speed. Did a site visit on, if I'm going too far into the details here, pull the gong show hook out on me here. Did a site visit back in April, did another site visit today. We have the topo flown from February 26th and trying to get our handle on, there's a lot of clean hard fill out there, a lot of concrete. Soil has been placed. If you've been to the site, there's soil stockpiles and there's soil cover. So we're trying to get the topo map to properly show, where debris is placed and where these other materials are. So we're working on that. We've taken care of a couple other things, the unloading zone, the fire prevention, unloading zone marking, the fire prevention plan that was requested, the debris compaction plan that was requested. The financial assurance was taken care of back on April 14th. And then there's been a number of activities associated with both Northeast Landfill and Springfield on their groundwater monitoring system. Part of that is, site inspection, well inspection for integrity, and then well development. Part of the issues was the concern over turbidity in the wells and making sure those wells are properly developed. They should have been out at Northeast, I think, today and tomorrow. We've already done Springfield. And in their normal course of scheduling, they've scheduled the sampling events, the annual sampling events for June 17th and June 18th, one day for one and one day for the other. Once you get the analytical back, which usually takes a little while, you prepare the reports, the statistics, and that. We're looking at our normal submittal turnaround for that, which would be for the 9/30 deadline of the normal license renewal submittal. The the set of drawings for the site has seen a lot of activity over 25 years. There's some drawings that date back to 1998, some from 2005. So it's kind of piecemealed over the years with 2 or 3 different consultants involved. So I'm basically trying to take that and rebuild that because as I understand it, and I could be wrong, what the health department's after is a clean, what I call an authorizing document or permit set. And I've done this for 30 years. I do it for a lot of sites across Ohio. And that's kind of the intention of where we're headed with it. They had a couple of violation letters in April. The first letter had some operational concerns. The second letter basically said a lot of those were addressed. I think the last 2 items were they have an unloading zone where they dump the debris. You pick through it, solid waste, tires, whatever might be in there, take that out, and then you can push it into what they call the working phase. And I've talked to them about making sure those are both clearly delineated, keeping the unloading zone separate from the working phase. The other comment that's in there is the concern over the slopes of the facility, and that's kind of what I'm working through now. The clean hard fill that's piled up, that's been placed over the years, is obviously steeper than the debris. And I have to try to properly represent that to Zibby and the health department. And I'm probably going to get a slope stability analysis done just because the regs require 4-to-1 slopes or 25%, whatever you're used to thinking about, 4 horizontal to 1 vertical. Normally in the state, all solid waste landfills are 3-to-1 steeper. And my experience has been 90-some% of the C&D landfills in the state of Ohio have gone to 3-to-1 by getting the exemption request. But to get the exemption approved, you actually have to do the slope stability analysis to prove it. I've never not gotten it. Basically it's one of those things. And I'm still trying to figure out what, if anything, was approved over the last 20 years on 4-to-1s or 3-to-1s, because there's a lot of people were said this and told that, and what was discussed at the site, and I'm trying to figure all that out right now. So that's my jibber jabber.
Okay. So it looks like a lot of work's been done and turned in. And it looks like we are looking for a recommendation to extend the deadline to submit all components of facility operation to July 17th. Is that correct? Okay. All right.
Are you good with that? Do you think you can, based on what you,
That's the first I've heard of it. That's why my brain is sitting there calculating.
so I think in your thing you had said the topo, you were hoping by the end of June,
Yeah, won't be able to get the groundwater stuff in.
and that's okay. We have never had a problem with them.
We can get,
getting the
we
groundwater.
can continue to give the updates, of course, and I'm trying to get those in early and in enough detail for the board to have them, so I'm going through a learning curve on that, so you have to excuse the lateness of the one update. The topo, yeah, I should be able to sit down with you before then, for July 17th. The actual full, complete set of drawings, we'll have to work out a different date for that, because I don't know if I'll be able to pull all that together in a clean package by then, so.
I think we've struggled with getting those type of things in the past. So, the groundwater monitoring, we've never had issues getting that. I think if we can get that topographic map, get a good start by the July meeting, and then everything else by
And then basically,
submittal time again.
get to that point, and then maybe you give me a little bit more leash.
Okay, so are we going to change this to read the topographic map instead of all components?
So the July 17th is our next board meeting, well, our July board meeting, September, June. That's where that date came from. I guess my recommendation would be keep it as is, since that's what we set in December.
Okay,
And then address it at the next board meeting, whether or not we want to parse out those pieces.
okay.
Yeah, so Zibby, what I will probably do is I'll probably plan on getting it to you by early July, end of June.
Okay.
And scheduling a sit-down meeting with you guys to go over it. That
Okay.
way you'll know where it stands, and then that'll give you plenty of time for whatever you would want from us or need to do with the board for the 17th meeting. Is that sound
That's perfect. for
like
me.
a good plan?
Yep.
So, yeah, I'm working on it. And we're trying to give updates and work through things, but that's kind of where I'm at.
Well, we appreciate all you're doing.
Yeah, appreciate it.
Okay, so we have a motion to extend the deadline to submitting all components for facility operation as required in Ohio Administrative Code 3745-400-11 to July 17th, 2025.
So moved.
Second.
Okay, Ms. Hackathorn.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes.
Okay.
I have a question on that. You just said all components are required by, but didn't we just talk about the topo map?
Yeah, so what we're gonna do is you bring us back another update like you did this time, and then they'll
Okay.
recess, and as
We're
long
just
as
moving the
Yep.
markers, the same
long as you
markers.
keep-
moving,
One by
yeah.
one.
Yeah.
giving us
Okay.
Okay,
updates.
all right. Yeah.
Right.
It's been a long day.
Drive safe.
I'm good to go.
Yes,
All
sir.
right, if you need anything, reach out. Thank you very much.
Yeah.
Thank you so very much. Okay. Okay, and so we have now, item 6A, new business, possible health nuisance at, 2609 Arthur Road. Ms. Witt.
Thank you, Dr. Moore. So this is a property that, back in April of 2024, we received a call, that they were pumping their septic tank out onto the ground. And then talking with the homeowners, we found that when we are in seasons of heavy rain events, it starts to back up into their basement. So at that time, we sent them information on getting a soil evaluation, septic designers, with their understanding that they couldn't be pumping the septic tank out onto the ground surface. They were able to schedule a soil evaluation the end of August of 2024. And then in November, we were notified that they had been working with a septic designer. And over the last few weeks, the designer has been in contact with us, working on getting the design complete. But we've continued to observe a pump and hose in the tank. So tonight, we're just asking you to declare it a public health nuisance this time. And I believe property owner and his designer are here.
Okay, did you have something that you wanted to add, sir?
I was at the site today and I was there last week.
Who are you, sir?
I'm Jason Connor.
Okay.
I'm the designer. The sump pump and hose are no longer pumping effluent onto the ground in front of the house. I'm continuing to work with Mr. Pollock to get clean waters out of his current septic system. We had the septic tank pumped today, and we have the pumping report if you want to see it. I emailed it to Zibby like a half hour ago, which I'm not sure if it's if that's enough time. And so we're working on doing what we can to have the existing system function less worse than it has been and put together a design. That's where we're at right now. And, you know, the homeowner is aware that pumping effluent out onto the ground isn't acceptable and has stopped doing that.
So, do you have a date
Date for,
that it would be completed, the new system?
I'm just the designer, so in order for, I do have a soils report, and have evaluated the soils report, and have talked to the soils report with Ms. DeWitt, not DeWitt, with Ms. Zibby, as she's indicated, we've been in touch with her. We're gonna have to, chances are probably 90%, we're gonna have to come back in front of the board before the design gets approved. Probably gonna need a variance, the length along contour. He doesn't have, it's not available at the yard, so what the code allows that for a given length along contour, if you split it in half and you separate it by 50 feet, that that's acceptable. However, in the back of the yard, we might only have like 30 feet. So we're gonna need a variance there. So the goal would be to, within the next two board meetings, have a design put together with a variance. And then as far as the installation of it, I think there might be a need for looking at funding through the Water Prevention Control Loan Fund Program. Hence, trying to do everything we can in the near term to help out the existing system. And there have been several efforts over the past month. I've only been involved for about a month or two to look at the existing records. The existing records show that there could have been a system installed, a replacement system installed in 2005. However, the record keeping at that time was not 100%. And I actually had a conversation with Mr. Rick Miller about that record, just trying to help understand what's going on with it.
Okay. So, thank you. I appreciate your input.
So we have a question. So, based on our observations out there, is there a sewage system that meets code right now? Functioning sewage system that meets code?
Well, I would say based on the pumping report and the fact that there was a hose pumping it out, that is leach field is probably not accepting all the water that it should be.
Did the report indicate that the tanks are leaking as well?
No, so
Okay.
it says the tanks are in good condition. Oh, yes, it does. I'm sorry. Evidence of
Both
leaking
tanks?
says yes. And a high water level.
We were both there when it got pumped out today. I would dispute the leaking part. There was drain back into, there's a 1,500 gallon tank, 2 compartment, and then like a coffin tank. And there was drain back from the coffin tank for probably like 10 minutes once it was pumped down. So the drain back for a time would indicate that, the leach field is flooded but hence that's part of the reason why we're in communication, to try and reduce the amount of liquids going out,
All right, so we have 6A before the board, a resolution declaring the property at 2609 Arthur Road, Springfield, Ohio, parcel number 180060001540011, a public health nuisance under authority of revised code 3707-01, and further ordering the owner, Kevin Pollitt, to abate the sewage nuisance within 21 days, and if such orders are neglected or disregarded, directing the health commissioner or his designee to pursue legal action under revised code 3707-02. And while the owner is working to abate the sewage nuisance, it is expected that the sewage will be properly disposed of, such as by a registered septic hauler, and will not be conveyed to the ground surface. And so that pumping was that second part, right? Okay. So this resolution is before the board. I get a motion?
So moved.
Second.
Okay, are there any questions, any more questions?
Just to clarify, because it talks about 21 days and he stopped bringing it to obviously this is going to be could be a 6-month fix, or it takes 6 months to get the design and get it approved and then to actually build the system.
Yeah, more the funding and getting it built.
So I'm not sure I don't know how I'm reading this. So the 21 days,
So as long as he continues to have a septic hauler pump the tank out
Right.
and sewage is not
Wonderful.
coming out onto the ground, he would not be creating that public health nuisance in that
Right.
time period. So as long as he continues working
Okay.
towards having it fixed and has it pumped by a septic hauler,
Okay, so what I'm understanding is that as long as you're getting that report, like how often does it have to be pumped?
That's-
Weekly?
It
Depends on
depends on the
usage.
usage, yeah.
Okay. And it's not coming to the ground within that 21 days, then we will not move forward with?
Correct. So declaring a public health nuisance
Mhm.
empowers us to take next steps if needed.
Yes.
But yeah, what Zibby said is right, as long as we continue to see movement, it's not stalling out, it's not creating that public health nuisance on the ground, we'll be happy to work with you guys.
Okay. But if that's not
Still declaring
happening,
it
then
gives
we-
us the tools that we
Right.
need to move forward if we need.
So in the event that we're not getting that, then we move forward with the
Correct.
legal action. Okay, all right, so that is what we have before it. Are we all clear on the understanding? Okay.
So currently, it's not a public health nuisance, but we're declaring it a public health nuisance?
Tonight we are.
That
Correct.
seems contradictory.
Oh, it was. I
And then
mean,
it
at
got
the
it
time,
pumped.
it was, and it is likely to go back. I mean, it's kind of a gray area, because that's why I asked
Right.
Debbie the question. I mean, if you're getting that flow back from the leach field, it's not an acceptable, when it comes to the code, to just have a holding tank, because in essence, that's what we're talking about now.
Okay.
We have a holding tank, we are not able to treat the sewage, and that does not comply with the Ohio Revised Code,
Okay.
Administrative Code, so.
Okay.
Well, flow back can have to be a multitude of reasons. It could be because the perch seasonal high water table is high at the moment. So in and of itself, that doesn't violate.
We didn't have that evidence before the pump, but because even without that evidence, the fact that we had to pump it onto the ground means this system is failing.
uh, It could be hydraulically overloaded from clean water sources.
That doesn't make it not failing though.
Well, if it's hydraulically overloaded and you remove that additional hydraulic load, then there's
Sure.
a potential that it's not.
Certainly, but in the current state, it's still failing whether there's a hydraulic load or not. The correction to make it not fail is like a curtain drain or something like that around the leach field. But if it's not properly working as it was designed, where the leach field is taking the effluent and filtering down, that's a malfunctioning system.
Okay, the letter was to abate untreated sewage being on the surface.
It's
That part
in-
has been removed
Correct, but this is declaring a public health nuisance.
because untreated sewage was being put on the surface,
And,
and that's no longer happening.
but pumping the tank is not acceptable. Using a sewage system that includes just a holding tank is not acceptable. Because that's what it is at this point.
It's not preferred, it is acceptable in others, via the OEPA, it is an acceptable method. I've installed 2 holding tanks in the past year.
Did you have to get a variance for them?
No, it's part of again, it was very unique circumstances, but through the OEPA, there's been 2 holding tanks that I've designed and been installed in the past year.
So for us, you'd have to get a variance.
Okay.
So
How old is this system?
It's very old.
Mhm.
The most recent record we have is from 2005. It looks like, I think Robin Berry went out and did a design to add a pump tank and leach field. The direction I was given by Rick Miller, who was here, who started in like 2006, was that on that record report, if it was signed off on, then that means that somebody went out and inspected it. However, during that time, there was sometimes systems got installed and they didn't get signed off on. So on the record we have for the property from 2005, there's no signature. So it could have got installed, or maybe it was installed. We just don't know. I did go out with the metal detector to try and find the pump tank, but the system is pretty deep. The top of the septic tanks are 3 to 4 foot deep right now. So I didn't find the pump tank, because the thought is if there was a pump tank and a bool valve out there as shown on the most recent record, then it's just a matter of maintaining the existing system.
How do we monitor the situation? What's our norm? Do you go back out and do an assessment?
We'll go out and do random
Okay, checks
checks
Or
or
complaint driven.
complaints.
or complaints. Okay.
Okay,
After a big rain or something like that.
so that we say it's 21 days, it has to be before the 21 days, so we know how do we move forward.
So we will go out and check it between now and then again, right at that 21-day mark to make sure that there's no evidence that sewage is being pumped out to the surface.
And so if there's no sewage, then he continues as
So
is, and if there is sewage, then we move the process forward. Are we all? Are we all under the same understanding as all of us?
Yeah, I think so.
Just one other question. You mentioned the funding source for getting this new system put together. Is that something we would work with this gentleman on? So we passed this resolution and we can still work with him to get the funding and get this system fixed. Okay.
All right. Any additional questions? Ms. Hathaway?
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette,
Yes.
Mr. Adamson.
Yes.
Okay, new business, 6B, grant application, Ms. Schaefer.
Before you get to that, if you, gentlemen, if you want to leave, you can. This is your opportunity. You can stay if you want. We didn't want to make it uncomfortable.
Nobody said anything. I was like, you're welcome to stay too. if you
Sure.
want. But, hey, thank you very much. I appreciate it.
Okay.
Thank you. I'm not doing anything bad. it.
Thank you.
Thanks again.
Okay.
See you later.
Good luck.
Okay, sorry, go ahead.
Okay.
Thank you. It's that time of year to apply for the next WIC grant for fiscal year '26. The funding amount offered of $1,057,328 is similar to our current grant year, or this current grant year, with a slight increase of $2,830, a slight decrease in our assigned caseload from this year's of 3,552 to 3,201 total participants. And the overall purpose of the grant offered by the Ohio Department of Health's Bureau of Maternal, Child, and Family Health is to improve the health status and prevent problems among Ohio's at-risk women, infants, and children. This is accomplished by providing nutrition and breastfeeding education, improving pregnancy outcomes, reducing infant mortality, increasing breastfeeding rates, and providing nutritious foods for that healthy start in life. I am requesting approval for our agency to apply for the available funds to continue providing this vital program to our counties, at-risk women, infants, and children. Thank you.
We have item 6B before the board. Can I get a motion?
So moved.
Second. Okay, Miss, any questions? Ms. Hathaway?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Item 6C, Mr. Cook.
Thank you. I don't know if you've ever drive in to our Homeward office here, but if you're facing the entrance to the right, there's a very large Norway spruce tree that is leaning. It's been leaning for some time. I put a couple, oh look, there's puppies up here too. The puppies are not part of the health department yet. So there's a couple images. I took it from a couple different angles and then a close-up of the root system. I've had some concerns about this tree for some time. I had somebody smarter than me come out and take a look at it. An arborist looked at it and explained to me why it was at risk. And that's why the middle picture is there. It's hard to see in this picture, but if you look at it on the left, the way it is not leaning, the roots go out kind of parallel to the ground. And so if you look on the right, you don't see the same thing because he says the roots are going down, which is why it's leaning that way. So is it inevitable that it's going to fall? In his opinion was yes. How long? Don't know. But I feel like we're either going to pay now or pay later. And I feel like paying later is gonna cost more because it'll be, when it goes down, it'll be an emergency service. It's gonna damage the pavement. It's gonna get dangerously close. What you can't see is it's right in angled with our gas meter out there. So there's a lot of risk here. I think we just need to bite the bullet and take this tree down. So this is unbudgeted. You see Huffman Tree Company for $1,500 will take the tree down, haul it away, and grind down the stump. I think this is a very reasonable, good deal, and I'm glad it's not an emergency situation, that we can plan for it, and we would take this out of the MAC fund for maintaining our grounds. Questions?
Okay, we have motion 6C for removal of the tree before you.
So moved.
Second.
Any questions? Ms. Hackathorn?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith.
Yes.
Okay, moving to item 6D, agency and personnel policies.
Yeah, two policies. So the first one is the agency and personal phone policy. This is, we're not blazing a trail with this. I looked at several other health departments' policies around this because ours was lacking a little bit. We had a couple sentences really that made up the whole policy in our personnel policy manual. And then we had a simple form that kind of contradicted itself. So this is just putting in writing some of the expectations that we have for people who carry our phones, or we're reimbursing for use of their cell phones. So it really does three things. It defines those expectations. There are agreements included in this if you have one of our cell phones, reasonable use agreements, and then same for reimbursement, an agreement for that as well. Also defines which staff members that we're designating for an agency cell phone, all of which we didn't have before. So just to be, consistent and going forward, we actually have a policy now that we can point to. We didn't have that before. So Personnel Committee looked at it, poked a couple of questions back to me. I think we answered okay. I'll ask those that are on the Personnel Committee if you had any other thoughts about this. If not, I can entertain questions now. If there's none before you take any action, I can talk about the other policy change. Okay. The second one is the pay scale policy update. So it's probably easier to tell you what's changing and what's not changing. That's when we had our admin team meeting this week. I presented something very similar to that. What is changing is we're adding positions that we actually have right now that never made it over to our pay scale system, putting those in the classification series that you see. I know there's a lot of colors on here, reds and blues and things. We tried to make that very obvious of what we are changing. So things that are underlined or additions, crossed out, obviously are being removed. We're also trying to standardize some of our position titles in that same classification, use some other terms that are used across other health departments in Ohio, just again, trying to get a little more consistent, clarifying some of the positions that are at the same pay grade as well, taking out some positions that we don't have. And the other piece of this is credit to Shannon for retyping literally every position description into a new format. It was overdue, and I'm glad we're doing it. It's a one-time push that's taken a lot of work, and I appreciate her doing that. But what's not changing are pay ranges right now. You see there's no changes on that side. This just isn't the opportune time to do that, to be very frank. It's still something that's weighing on me to be able to be a good and competitive employer in our community. So my hope is that's going to come at some point in time, but right now this is really a cleanup of what we've needed to do. Shannon and Gracie and I have been making notes on this for several months about things that we need to change. We got all those changes put together, and that's what you see here today. The second piece of this is what you'll read in the resolution, though, is specific to abolishing some of the positions, again, that we are removing that we don't have or abolishing for reorganization purposes. So I'll be happy to entertain questions as well. I think there were a couple questions from the Personnel Committee about this one too, but I think we answered those. And again, I'll offer if the Personnel Committee has any feedback, you can share it now.
I couldn't find Shannon because I'm thinking, where is she?
You couldn't find
But that's changed.
Found her.
So yeah, we thought it was very thorough and well done. So both policies actually.
Okay, we have item 6D before the board.
So moved.
Second.
Any questions? Mrs. Hackett?
Dr. Moore,
Yes?
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith.
Yes.
Okay. Item 6E, Mr. Cook.
Twice a year, we have a workforce development day. We have one in the spring, one in the fall that we close down and go off-site for our professional development for the staff. The second one of the year is now scheduled for October 10th. And then the other time that we shut down, the only other time we shut down, other than holidays, of course, would be for our annual all-staff meeting. Once a year, we do have an all-staff meeting for half a day. So we will shut down at noon on December 12th. So just like your approval to close the offices those 2 times.
We have item 6E before the board.
So moved.
Second.
Any questions? Where are you going off-site?
So Workforce Development Day is at the Clark State LRC, which is a great facility. And for the annual all-staff, last year we went to the Art Museum. They have a very nice big community room with nice windows. I think we're going to go back there again this year. It was very nice. I think everybody enjoyed it, right? Some of you, yeah, okay.
Nice. All right, any other questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. Okay, 6F, staffing changes, Mrs. Hackathorn.
Thank you. You have the report there, which shows we did have a couple new hires, both in WIC. So if you have any questions, Emily would be happy to answer them for you. No resignations, so that's good.
I'll add one. This seems like a good, I know that you were going to.
Go ahead.
Okay.
Go ahead, please.
So very happy to announce that Cheyenne Taylor is going to be our next director of nursing. I did share that with the board, shared in a huddle with the nursing staff and then the rest of the agency today as well. So Cheyenne is here. So Cheyenne is here. I sent you I sent you her resume just so you can see her background. She's been with us about 6 years now. And she's currently a nursing supervisor, and on June 2nd will be our new director of nursing. So super excited to start our time with Cheyenne as our director of nursing. See where we're gonna go with her under her leadership in nursing. So
Well, welcome to your new position.
Thank you. Yeah.
Okay,
Well, let me just say thank you for 23? 26?
23.
23 years?
oh my gosh.
My gosh, you know, I know it's a calling and it's something that you do. So now you're able to hopefully give that care to family and yourself and take care of yourself. I really appreciate all you've done
Well, thank
here.
you. Thank you. It's been a joy.
Yeah. We were talking today about all the different roles that you have had. Okay. And stuff, and I was like, those are pretty hefty shoulders you've had.
Well, thank you.
I'm
And you've
thinking,
done it so well.
when we put the one position about the accreditation,
Yes.
there's no one in this world will take this job. Christina did. And then back to nursing. So
Yeah, it was great. It's been great.
You've been wonderful. So really
thank
appreciate
you.
all you've done for Clark County.
Yes. thank you.
Yes. Okay, we have item 6F before the board.
So moved.
Second.
Any questions? Mrs. Hackathorn?
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes. On to financial reports, and we're going to have those done by Mr. Cook.
So you have the bills that we paid in April in front of you. Be happy to entertain any questions about any of those bills.
Any questions? All right, so we need a resolution to approve the bills.
So moved. Second.
Any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Dr. Robinette?
Yes.
Okay. And 7B, it looks like we have no
Correct.
budget, so nothing there. And 7C, monthly fund reports.
Well, you've got the typical reports in there, plus this giant colorful one that challenges your eyesight. Just a couple of quick notes about this. Again, continuing to make this as clear as far as our financial picture as possible. The one change this month is just for clarity and condensing. Any fund that we're actually not using that has a zero balance has been removed. They were on there just to say, hey, we do have this fund available, we're not using them, but just to give me a little more room and increase the font size by like half a point. I did that on here, got rid of those that have no budget, have no expense at all or income this year. I'll just point out if you look down at the bottom line, we're at 40% of our original budgeted income. Again, through April, that's pretty good. I know as I've told you, some of that is cyclic. Depending on what time of year we are and what income we're receiving, whether it's from levy settlements or from environmental health fees coming in altogether. But you can see where we were as compared to last year, we're at 45%. But actually the actual dollar amount is higher. We're at 4.2 million last year as far as income, and then 4.5 million this year. So 40% of that is a good, healthy place to be. And then on the expense side of things, we're at 27% of our budgeted expenses. We have spent pretty close to what we were last year. We spent about 3.3 last year at this time and this year at this time. Bottom line, current fund balance is about $4.5 million, which is good for our cash flow. Because like I said, things are cyclic. We'll have a couple months now where we don't have any levy income and some other things. So at the end of the year, when you look at those incomes and expenses keep floating along while the income goes up and down a few times. So I feel good about this. Maybe next month when Jeff's here, he'll say something otherwise, but just kidding, Jeff. But I'll be happy to entertain any questions that you have about the overall financial picture of the agency.
Okay. Any questions? Okay. All right, public health team reports. Ms. DeWitt.
Thank you, Dr. Moore. So May is the start of another wave of busyness in environmental health as we're finishing up inspecting the, I believe, 29 manufactured home parks that we have in Clark County. We start our first round of campground inspections for the year, and we work with all of our seasonal pool operators who are wanting to get their pools open for summer. So we will be busy doing all of that this month. And then I just want to let you know that we were notified that we did not receive funding for our mosquito surveillance program this year. So we will not have our typical trapping of mosquitoes, testing for West Nile, treating for larvae, adult mosquitoes, things like that. But what's not changing is the education piece. We're still going to get that message out because as we've seen over the last handful of years, we know West Nile is endemic in Clark County. And so we're going to keep pushing that message to protect people from West Nile or mosquito-borne diseases. But that's all I have tonight.
Thank you so very much. Any questions? Okay, I'm moving to nursing and clinics, Ms. Conover.
Thank you, Dr. Moore. Immunizations, I really want to say thank you to the immunization team. Our ProLink nurses have left at the end of April, and so we've had a couple weeks where it's just the group, the core group, and they're just really doing a great job continuing to serve lots of people. At the back of the report, I noticed that Cheyenne and her team had done an IQIP process or an IQIP report. And so often we have that Get Vaccinated Ohio grant that we put before you, but it's hard to explain some of the components of what it actually does. So when I saw that she had recently done one, I went ahead and just added it to the back of the report, which is just kind of a small QI aspect saying, you know, just kind of keeping everybody on the same track of what we're doing to move things ahead with regards to vaccinating effectively and making sure we're looking up records in the registry prior to vaccinating so we don't repeat resources and things like that. So yeah, that's what that is and then why it's included. As far as the reproductive health, I just wanted to give a shout out, thanks to Community Health Foundation. They funded us again to help supplement the work that goes on by that team in the jail, the Clark County Jail. As you know, we cannot, Medicaid reimbursement is not available when a person's in the jail, so the service is supplemented this way. And then I believe that's it. Thank you.
Thank you very much. Any questions? Okay, thank you. Early childhood, Ms. Lambert.
Thank you, Dr. Moore. I just had put this in the packet, I think, just to acknowledge that the governor had denoted a week in April as the first home visiting week, so I thought that was pretty great. So the managers, the two supervisors and I did a few special things for our staff during that week to just tell them how much we appreciate what a great job they do. And to that, we have one of our newer home visitors. Would you like to stand up? This is Rose Wessner, and she started with us part-time. What month did you start with us part-time? Okay, in November. And she's been doing a great job, and she's moved to full-time just recently in the last month. So we want to welcome Rose to our team.
Yes.
That's all I have.
Any questions? Okay. Women and infant, Ms. Schaefer.
Thank you, Dr. Moore. I tweaked the report a little bit. I added the sections in gold. I think we got some questions about how many participants in New Carlisle, so I thought that would be good to separate out. So that's part of the upper part of the table with the gold. It shows the total number of participants for each of our clinics. And then the second, towards the bottom, the WIC in Springfield Regional Medical Center visits, the breastfeeding information. So exclusive, partial, and minimally breastfeeding, as well as non-breastfeeding, the percentages. So I thought that would be helpful. And I think I mentioned before that this may morph as we go on. And then I did have some corrections, so that's what the yellow highlight is. So March, between Ashley's reporting and our contract dietitian, Ashley's reporting, she was doing it by email, and then she developed this nice spreadsheet. So I've been toggling back and forth between those two, and I think I missed some visits, obviously, so I wanted to correct that, which if those visits were higher for that month. And then the original report that went out to you earlier in the week, I had April's a little off, so I wanted to get those corrected. So those are the updates or corrections. And then I did just want to say that we are thrilled to have our new staff starting. Our breastfeeding part-time peer helper started on Monday, so she's been starting training. I probably will not get her last name right, but it's Valerie Bednars. Oh,
We
thank you.
practice.
Okay. And then Erin Sanford, she used to work for us before COVID. She was our breastfeeding coordinator at one point, and she was one of our staff that did the first brought her infant to work, so for our team. So we are thrilled to have her back for 1 to 2 days a week for our health professional side. So excited to have both of those team members joining us and just to serve our participants. And that's all I had, unless there are any questions.
Any questions? Thank you very much. Okay, health planning.
Thank you. So you have the packet in front of you, so I'm happy to answer any questions. There's a few things to highlight. I too will thank the Community Health Foundation. We received funding for our Start Strong Clark County, so our infant mortality coalition. So that funding particularly goes to fund a contract coordinator for that group, which is Anne-Marie Smearsall, who has been in that role for the past 3 years. She is a nurse practitioner by trade, so she is very knowledgeable and keeps that coalition one of the most active coalitions here in Clark County. So we're very thankful to the Community Health Foundation to providing that funding to help keep Anne-Marie on. Another, just two things that I wanted to highlight, through our adolescent health grant every year, we partner with Springfield Promise Neighborhood to provide a free summer camp for 5th to 8th graders in Clark County. We are doing that again. It's called Life Sports. Kids can come. It's Monday through Friday, pretty much all day. They get breakfast and lunch. And learn sports, but also learn life skills and coping skills and things like that. So that will run from July 7th to August 1st at Lincoln Elementary. Like I said, we partner with Springfield Promise Neighborhood, and they really are the ones that hire the coaches and staff because that's their area of expertise, is working with youth. So we're very thankful for that partnership. And then the last thing I will mention is this Saturday, May 17th, from 12 to 4, we will be having our annual Click It or Ticket kickoff. So through our Safe Communities grant, nationally, there's kind of a push around Memorial Day about Click It or Ticket. So wearing your seatbelt when you're in a car. Every year we do some type of event to kick off that campaign. This year we are partnering with the Partners in Prevention, which is our youth-led prevention coalition organization here in Clark County. Also with the Sheriff's Office, Springfield Police Department, Springfield Fire, to have a summer safety kickoff. So we will be doing a number of different things. There'll be local vendors, resources. We're going to be doing a watermelon drop, which we did a couple of years ago. So we're actually going to have the fire department's ladder truck and a old car and drop a watermelon from different feet to simulate an unbelted crash. So it is, it sounds fun, but it is very impactful when you see what damage can be caused. There will also be an opportunity. We are partnering with the Springfield Links. They have some grant funding to provide educational information about substance use while pregnant, and people can sit through that presentation and get a car seat or a diaper bag or something like that. So it's really all safety stuff. The Sheriff's Department's DARE team will be here, fire protection team. So we're really excited. I think the weather looks good, but it is taking place here, actually in this parking lot behind us, from 12 to 4 on Saturday. Thank you.
Okay, thank you very much, Judy. Any questions? Okay, we have a legislative update.
Just have a couple things to update you on. Gracie will probably talk next month about the Minority Health Fair, but how successful it was. Yeah, I figured you were still working on the data, so I'm not going to ruin any of that. I'm just going to tell you anecdotally, being there, working, trying to do whatever I could to help the flow of things. It's very impactful to volunteer and do that and be there to see the people that are the ones that need served the most. And actually, my wife was there volunteering this year, and afterwards she said the same thing, like she'd never volunteered there before. She made the same comment. So, but again, a lot of the work, I was not the work. Gracie was the work that went into it. I was just there to help and support the day of, but it's just very impactful to serve people in that manner. So two things, really, some legislative updates, but first I'll just mention to the board our agreement with the Community Health Foundation for our High Street building ends this summer. And so I've been in negotiations with them to continue to use that facility for both our WIC and early childhood programs. Negotiations are going well. Don't have anything to announce to you, but I feel like next month when we sit here, I will have something to bring to you. But they're just good partners. You heard two examples of that. I mean, yeah, it's funding. We know that helps, but they're just always there to be supportive. So Community Health Foundation gets a gold star for sure. Then just a couple of updates on legislative items. I just want to mention a couple of things that are really concerning to public health in the state budget bill. I know we've talked about the feds here for a minute, but just talking about the state, a couple of areas that are getting reduced funding I just want to call out is in the area of tobacco and cessation efforts, things like our TRL, Tobacco Retail Licensing Program. We get a lot of funding that we have to have that program from the state. It was proposed to continue level funding at about $10 million in the state budget. Right now it's at $6 million. So it's a significant cut. in the big pot. I know that doesn't seem like a lot of the state's budget, but for us locally, that is going to be a lot. The other one that was extremely impactful is the dollars that we get for our lead program and Lead Safe Homes. We have done a lot. Actually, we're doing something this week in this very room. We're educating contractors on how to abate lead and remove it from houses safely. How many people do we have? Eight? No, 8. We have 8 people, contractors. They've been in this room all week learning from an instructor on how to do it. It's a week-long course. We pay for their certification, their test. We pay for the wages that they're losing by being in this class. The grant allows us to do all of that because the more capacity to get it done correctly, it just benefits our community. That is going from about $8 million in the state to $250,000. So it's basically wiped out. It actually got wiped out, and then they said, oh, we'll give you a little, $250,000 across the state, not the Clark County. It's very concerning. I don't think this is the end of it. I think there's a lot of lobbying going on from AOHC, Association of Health Commissioners, to try to get some of this money restored. So while it sits right now, it's basically all wiped out. I still believe that there's some possibilities of getting some of it back. So watching it very carefully, working with our lobbyists to try to influence and understand how important it is to not just Springfield and Clark County, but across the entire state. A couple other things I have some updates. House Bill 28, which was to eliminate the ability to do a replacement levy, is still in committee. Right now, as of today, it's still in Senate committee. It passed through the House. It's still sitting in the other side of the legislative branch. No updates there. There was another bill, House Bill 245 was introduced, which is parenting and pregnancy programs and services across Ohio. Again, House Bill 245, if you Google search for these, you can find them very easily. It's the first shit that comes up. Just type Ohio, House Bill 245. Really, it does a few things. It increases the scope of this program and the services that are being offered throughout Ohio. Right now, it's through age 1, 12 months. It expands it all the way up to age 5. It's what it sounds like. It provides parenting services, material support, things like that, through a variety of programs through DCY, Department of Children and Youth. And it actually adds, it sounds like, some funding mechanisms that we might be able to apply for into the future. But again, it's just a House bill right now. Don't know what it's really going to look like when it's all done. But it added a few components like pregnancy testing, family planning efforts. I'm just kind of watching where this is going. I'm not sure how it's going to impact our programs from both early childhood and reproductive health programs, but if it's additional resources and programming that we could avail ourselves of and there's funding that goes with it, that's even better. So we're just kind of watching this House Bill 245 right now. Another couple of House bills, and then there was a resolution that was passed recently. House Bill 182 would prohibit public water systems from adding fluoride to their water. It's referred to the House Committee on Natural Resources. It is a very short bill. It's like 2 sentences, and it basically would say in a municipality, you're not allowed to add fluoride to the water. We know through our oral health coalition, we had a oral health coalition meeting we had a couple weeks ago. There's concern about this. We know that in the city of Springfield, one of the few municipalities that doesn't add fluoride to the water. We do have higher rates of dental caries and decay, but it'll be interesting to see how this moves or doesn't move. It's been stuck in House committee for probably about a month and a half at this point. I don't know any more than that. I know it's being reviewed by the Natural Resources Committee. So we're just kind of watching where that's headed. And then finally, just a resolution I'll share. This kind of floated through. This isn't a House bill, a Senate bill, or anything like that. It's a resolution that was passed in the state legislature commemorating May 6th through May 12th as Nurses and Health Professionals Week in the state of Ohio. And so that week will be recognized. It's not as fancy as yours, Lori. This is what I printed, but very much deserving to recognize our nurses and health professionals that week going forward in Ohio. So just happy to see that get passed. And I believe that's it, unless there's any questions that I can answer for any board members.
Okay. Doesn't look like we have any need for executive session unless I missed something. Additional business, Mr. Cole.
Yes, I have one item of additional business. Board members, underneath all of your papers, you will see something that looks like this. I am so sorry, Christina, that I am going to embarrass you just for a quick minute. But you knew it was coming. This doesn't seem like enough, frankly. But what you have is a resolution of commendation for Christina and her service to Springfield and Clark County. And I'm going to read it. And it's long, but you need to hear it out loud. Whereas Christina S. Conover has faithfully served the citizens of Clark County, Ohio since June 24th, 2002, as Director of Nursing for most of her 23 years of service. And whereas Christina has used her expert knowledge and experience to thoughtfully take action to prevent injury, spread of disease, promote health and well-being, and protect citizens against threats to the public's health in Clark County. And whereas Christina's thoughtful focus on health equity and her whole community approach to health have improved the health outcomes of the most vulnerable and marginalized people in our county, always putting others first before herself. Whereas Christina has not only earned the great admiration of the Clark County Board of Health and their employees, but also the admiration of county officials, first responders, hospital leaders, partner agencies, state and local public health officials, and the citizens whom she has devotedly served. And whereas it is the desire of the Board of Health to express sincere and profound appreciation to Christina for giving tirelessly, generously, compassionately, and sacrificially of her time and efforts. Now, therefore, be it resolved that the Board of Health, on behalf of the citizens of Clark County, extend to Christina S. Conover a humble expression of esteem and gratitude for her dedication and service to the residents of Clark County.
Thank you. Thank you so much. I appreciate it. I appreciate the opportunities, really. I know I said that word before, but truly, you know, there was so many times when I just thought, how am I this lucky to find a job that I just can, you know, you sink your whole self into and just, you know, build. And then the next day is even more, you know, and so I am so grateful for all of you who gave me all the opportunities, and thanks to each of you around the table and in the audience.
It's been a pleasure.
Yes.
Well, in addition to this resolution of commendation, one of the other things that I believe you have is something that looks like this. We are going to embarrass you just a little bit more. On the 29th of this month, we're going to invite the community and partners that want to thank you for your service and say farewell and wish you good luck on your next chapter. That'll be from 2 to 4 p.m. on Thursday, May 29th in this room. So looking forward to celebrating you in 2 hours that I know are going to be a struggle. I know you well enough to know, but you got to do it.
Oh, I
Yep.
understand. Thank you. Thank you very much. I'm honored.
Shoot. I put everything up.
She's done.
Okay, next meeting date is June 18th, 2025. And
A Wednesday.
A Wednesday.
Wednesday.
Yes.
Oh.
Yeah.
Wednesday.
Because it's
Wednesday.
Juneteenth is Thursday.
Wednesday. Okay. And so we are now adjourned.
Need a motion?
Need a motion. Come
So
on.
moved.
Second.
All right. Call the roll.
Voice vote.
Voice.
Voice.
No. voice vote.
You almost made it.
All in favor?
Aye.
Okay. All opposed, same side. This meeting's adjourned. Thank you.